Medical Dialogues. I'm Mr. Zaman. Let's look at today's top health highlights. Cystic fibrosis drug could help treat pneumonia. Pathogens such as SARS-CoV-2 and pneumococcus can cause severe pneumonia. If the airways then fill with fluid, the patient risks developing acute respiratory distress syndrome. Researchers at Charité Universitätsmedizin Berlin have now discovered the molecular mechanisms that trigger fluid accumulation in the lungs. This also led them to discover a potential new therapy, a cystic fibrosis drug proved effective in their laboratory experiments, raising hope that this could be used to treat pneumonia regardless of the pathogen that caused it. A cystic fibrosis drug proved effective in their laboratory experiments, raising hope that this could be used to treat pneumonia regardless of the pathogen that caused it. The study has been published in the journal Science Translational Medicine. Pneumonia is the most common cause of fluid buildup in the lungs. This condition, known as pulmonary edema, results in parts of the air spaces filling with fluid instead of air, which prevents them from doing their job of exchanging gases. Patients struggle to breathe and their body can't get enough oxygen. The diagnosis is acute respiratory distress syndrome, or ARDS. The researchers have now shown for the first time that cells in the blood vessels of the lungs also have CFTR, and that its presence is drastically reduced in pneumonia. The study findings indicate that the loss of CFTR causes chloride to accumulate in the cells because it stops being transported out of them. The excess chloride triggers signaling that ends with an uncontrolled flow of calcium into the cells via a calcium channel. The increased calcium concentration then causes the vascular cells to contract, much like the effect that calcium has on muscle cells, explains Professor Quebler. This results in gaps between the cells, which allows fluid to spill out of the blood vessels. Chloride channels are therefore crucial in maintaining the barrier function of the pulmonary vessels. Professor Quebler said that, "We hope our findings will pave the way for clinical trials to test the efficacy of CFTR modulators in pneumonia patients. If this promising pathogen-independent therapy finds its way into clinical practice, it could benefit a huge number of patients and prevent pneumonia from becoming life-threatening, even in the case of unknown pathogens." That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.